Hello, my name is Diana Prevelis, and I'm going to talk about a healthcare service that's currently on the market, and it's called a non emergency medical transportation, also known as NEMT. Um, Now, a non emergency medical transportation is a transportation service offered to consumers in the healthcare industry. And these consumers, they need help getting to and from their medical appointments. Now, according to the Centers for Medicaid and Medicare, NEMT services first began in the 1960s after the establishment of Medicaid and Medicare, and it is a specific benefit to Medicaid beneficiaries. The establishment of Medicare and Medicaid was all about increasing access to care, removing monetary barriers, and addressing the needs of the elderly, the disabled, and children. And this service is critical in addressing these issues. Now, according to a Community Transportation Association study, and I got the citation from Kaiser Family Foundation, approximately 3.6 million people in the United States miss a doctor's appointment or postpone going to a doctor because they do not have a way to get there. And 950,000 of those are children. So many people are affected by transportation, and many of these people are low income, have no car, and have no access to public transportation. So, of course, people who live in cities or urban areas, they're going to have more access to public transportation, but not all people live in the city. So, we know that there is some disparity there. The majority of these people are low income and they do not have a working vehicle. So, non emergency medical transportation alternatives are available for these people free or with low pay. And that's what NEMT services provide. So, because low income victims fall between the cracks, NEMT benefits fill those gaps of services. So these patients are patients with that need behavioral health services, preventive health services, and care for chronic conditions. And that brings us into the target market. A lot of the people that NEMT organizations target are the primary care physicians, the specialists, the nurses, the office managers that work at these healthcare organizations because they have direct contact with patients that need these services. Also, Medicaid and Medicare and NEMT organizations try to contract with these Medicare and Medicaid services or insurance companies so that they can access the people that need this care. Um, Also targeted are patients that need to be transported to medical facilities for routine appointments and checkups. These patients also instead of using ambulance services, they can use NEMTs because these NEMT vehicles, they have wheelchair assisted services, stretchers, some are flight services, and also courier services. Now, the patients, again, can consist of the elderly who are increasingly facing health disparities because of lack of transportation and because of chronic illnesses. Also, suffering are the disabled with chronic illnesses or mobility issues. These patients can be private payers, people who may not qualify for Medicaid services but pay out of pocket. But with these payers, NEMT services must take time to establish and build a relationship and reputation to maintain these types of customers. Another patient that NEMT services Target our Medicaid beneficiaries because, again, the Medicaid specifically pays for this service for their consumers. And so Medicaid beneficiaries are either low income, elderly, or disabled. And for the patient, transportation is free to and from medical appointments. Also targeted are medical facilities because, again, these places have access to the patients that NEMT people service. It could be medical centers, dialysis centers, these kind of services, nursing homes, and retirement communities. Also, NEMT organizations have been working with schools because they are students that have disabled, disabilities, and they often need help to and from home and school. So, some of the strengths that NEMT organizations have are accessibility and convenience. It gives patients a greater degree of safety. It also helps patients maintain independence and the affordability factor. So let's talk about each one of those. Again, one of the strengths, accessibility and convenience. Many patients need special transportation because of disabilities or if they have mobility problems, as I mentioned earlier. So NEMTs have vehicles that can cater to those needs. Convenience is another factor. Many vehicles can handle wheelchairs or have special equipment, things that a city bus may not be able to help them with. These vehicles are all up to date per federal and state standards as well, and it allows patients to travel comfortably and at the time that they need because sometimes the city bus is not going to help them make their doctor's appointments, but they can schedule those things with an NEMT organization. Another strength is the greater degree of safety. So NEMT workers, most of the drivers or companions that work with these organizations have backgrounds in nursing and healthcare, or they used to be drivers. And all of these workers receive certifications and training to maintain qualification. And so any consumer should feel safe in one of the vehicles. Another strength of an NEMT is it helps elderly people, the aged, or the disabled. They feel more independent and they're able to maintain some independence. A client can make a phone call to an NEMT center to provide the necessary information and help them get on their way. This can be a modest act on behalf of the consumer, but being able to call an NEMT center can help them feel more independent because they're taking care of something by themselves. Patients can also practice independence by using non-emergency transportation instead of relying on family and friends. Instead of asking a friend or family members to drive them everywhere they need to go, they can also call an NEMT. And again, it's covered by Medicaid, but even if they have to pay out of pocket, which we will talk about later, it's cheaper than calling a rideshare like Uber or something like that. So making a doctor's appointment on your own is a simple achievement that any young adult or disabled person will be proud to accomplish. Also, affordability. Many clients are covered by Medicaid for this service, as we stated earlier, and or have to pay a small co-payment. So even if a patient has to pay out of pocket, it will still be cheaper than taking an ambulance or paying for typical rideshare services. So ambulances we know are very expensive and it burdens the healthcare system. So if we could avoid using ambulatory care, it's a win-win. One last thing about a strength, it does offer clients with inner peace. Just something you don't have to worry about. If you know you have to go to the doctor's office and not having to worry about how to get there. For people that may have certain health problems, hearing impairments, mobility issues, transportation can be a source of anxiety for them. So just knowing that your ride is a call away or it has already been scheduled gives you that peace that a patient would need if they were to make an appointment. Now, some of the opportunities that an NEMT organization would be able to obtain in the market would be the profits. And so, how can an NEMT business profit? One thing they can do is focus on location. So, the location of the company and the region of your performance greatly influence the prices. So, depending on where you work, whether it's in New York, in Pennsylvania, in California, all of these things, all of these places would affect the expenses and the amount of money you would make. So, depending on where you're located, that could be a factor in opening a business. You would consider where you would open it and see how much money you would make, because depending on where it is, you can make more money. So, we know that California or New York might profit a company more than somewhere like Kentucky or Texas, maybe. So, promotion. You're able to promote your business, an NEMT organization. You can promote your business more to hospitals, nursing care, doctor's offices, lab facilities, retirement communities, adult daycares, etc. There's so many places. Wherever they have direct contact with care, that's where your market is. That's where you would promote your business. And you would leave your marketing material there and try to set up long-lasting relationships with these organizations so that you'll be able to acquire new clients. Also, using brand power, making a name for yourself, using a user-friendly website that engages current and potential clients would help with your marketability. Also, collaborations. A collaborations would be a strength for NEMTs, because if you collaborate, you can build your business. One of the trends that's been going on is NEMT organizations have been collaborating with transportation network companies. State and health care providers are partnering with these TNCs, the transportation network companies, and in turn, the TNCs are partnering with NEMTs to be able to access a broader patient pool so that they can gain more clients. And so they've also been partnering with Uber and Lyft. So NEMTs are getting in there as well and partnering with these federal and state organizations so that they can access the people who need their services. Also, NEMTs have definitely positioned themselves in the market. Factors such as the growing need for non-emergency medical transportation and a rise in the incidence of chronic conditions are driving the market growth for NEMTs. According to Research and Markets, quote unquote, the global non-emergency medical transportation market is estimated to be worth $8,562.06 million in 2023, and by 2030 estimated to reach $13,873.13 million, which is up by 7.11%. And so it's just been growing even over the last few years. And again, these numbers represent services using ambulatory vans, minivans, stretcher vans, wheelchair lift equipped vehicles, and the businesses also serviced are courier services, because people are not only using it to get to their doctor's appointments, but also using it to get to the pharmacy to pick up certain things that they may need if it has to do with their health care. And it also covers insurance-backed patient transportation and private pay patient transportation. So the market share is extensive for NEMT businesses. In summary, non-emergency medical transportation is critical to keeping patients and families healthy. We thank God that NEMT benefits are included as a benefit for Medicaid beneficiaries. It is a cost-effective healthcare measure that reduces healthcare utilization, such as ambulatory services and emergency room visits, because it addresses access of care and it helps patients get to their doctor's appointment. According to Centers for Medicare and Medicaid, on average, NEMT services account for only 10% of the total Medicaid patient base. The costs represent only 1% of the department's total spending. This service is worth the cost, and need will continue to grow as the incidence of chronic diseases rise and as the aging population rises. Isaiah 46:4 states, "Even to your old age and gray hairs, I am He. I am He who will sustain you. I have made you and I will carry you. I will sustain you and I will rescue you." And I challenge every healthcare worker to hold fast to the Word of God and to do as He would, taking on that personal accountability and sense of responsibility to care for the elderly, the disabled, and all those that are in need. May God bless you. Jesus loves you. Thank you.